Unless anyone from my team wants me to wait a few more minutes, I think we'll get started. Is that okay? All right. Hi, I am Dr. Fahimeh Sasan. Right here is Dr. Sicily Garvin. She's one of our reproductive endocrinologists and infertility specialists. The two of us will be your hosts this evening. Just for housekeeping purposes, for everyone to know, we have several members of our Kindbody team. They have Kindbody before their name that are here, including our amazing physician assistant, Hina Ahmed, and some of our patient navigators. Please include in the chat throughout this discussion if you have any questions. I assure you any question you have is probably a question that many people in the audience have. The ones that many of the questions we'll answer as we go, so keep an eye on the chat. And then for those of you, and then we'll address some of the bigger questions or some of the more common themes at the end as well. But without further ado, we'll get started. And again, I'm so happy that you're here. So I'm Dr. Fahimeh Sasan. I'm a board certified OBGYN and the founding physician of Kindbody. Right here in this picture is Dr. Sicily Garvin, who is one of our fertility specialists. And as I mentioned, she'll be joining you and leading a portion of this talk in the second half. She's standing in front of what has now become our famous Kindbody flower wall. So if you come into one of our locations, you'll be able to see that. But we're really happy that you're here. The topic of this discussion is called Fertility Unfiltered. And as always, we really encourage all of you to own your future. And by that, we mean to hopefully feel empowered about the information and the knowledge, which is so important. And then what you decide to do with it once you have the knowledge is obviously unique to you and the path that you're at and the stage that you're at in your life. But we'll go ahead and get started. And good evening to all of you. Good afternoon again. All right, so meet Kindbody. Kindbody is truly on a mission to really reinvent the delivery of reproductive and fertility health. And we want to make it accessible to all. We have centers across the country, and I'll go over with you the exact locations, but truly from coast to coast, with a mission to really end the fragmentation that currently exists in our reproductive healthcare system. I'm sure that many of you can attest to the fact that when you go to the OBGYN, you go one place for your pap smears, you go to another place if you need fertility care. If you happen to have a male partner, they need to go to another place for semen analysis or to get evaluated. And then in between, no one's really taking care of your mental health or your nutrition. So our goal at Kindbody is to really bring all of these things under one roof, led by women and experts in the field, including OBGYNs, fertility specialists, embryologists, physician assistants, nurses, sonographers, really with a common mission that we want to be your partners in this journey and to really improve access. And a key part of improving access is improving the education and information that's out there, which is the focus of our discussion tonight. On the right-hand side of the screen, you see a picture of some of our New York team members. It includes our nurses, sonographers, physicians, nurse practitioners, and key to this time, as always, is safety as COVID. And so that's something that we really take very seriously in our clinics, both for the protection of our team members as well as for you and your family. All right, so what do we do? Kindbody really has three spectrums of the care that we provide, again, all under the same roof. Fertility is a really important spectrum of what we offer, including assessments just to learn more about your fertility. We do virtual consultations as well as in-person consultations. We do egg freezing, embryo freezing, fertility treatments, including insemination and in vitro fertilization, which Dr. Garvin will be telling you more about in the second half of this slide, as well as donor egg and donor sperm as it relates to trying to conceive, and genetic testing, which becomes such an important part of the fertility process, whether you're trying to conceive naturally or through fertility treatments. We also provide the entire scope of gynecologic care, from those routine well-woman checkups and pap smears to urgent GYN visits, whether that's fibroids or endometriosis or PCOS, as well as preconception and just preparing for that pregnancy, contraception, IUDs, management of abnormal pap smears and abnormal bleeding. We have gynecologic surgeons on our team that can do some of the most extensive gynecologic surgeries, as well as minor procedures as well. So truly comprehensive gynecologic care. And then I like to say, as an OBGYN, if all we do is take care of your vagina and uterus, we've colossally failed you. So we also provide donor and surrogacy services, as well as nutrition and wellness and mental health, which is such an instrumental part of a woman and our man's health. And we're also really proud of our LGBTQ services that we provide, whether that's understanding the options and various pathways to parenthood, or in helping you understand preservation maybe before a transition. So those are services that we provide in all of our clinics, and we're going to be expanding on some of these services over the next few slides. All right, so we're truly on a mission, and I think this year, or now going on to the second year of dealing with COVID, has become more important than ever for all of us to really understand that reproductive health and fertility are so essential, and that time is not on fertility's side. And so it is imperative that all of you that are here with us tonight, obviously something brought you to this meeting, this hour session with us, but to really take it to the next step and realize how important it is to have your fertility evaluated, regardless of where you are on your life's journey, whether you've been trying to conceive for a while, maybe have dealt with the trauma of miscarriages or pregnancy loss, or maybe you have no plans of having a child anytime soon, or maybe thinking of having children 10 years from now. It's really important to access this care, to learn more about your body, learn more about your fertility, learn about your partner if you have one's fertility as well, so that we can really provide the care at the right time with the right provider, and really take into consideration that fertility does decline with age. And we're here to be inclusive, and we're here to empower you with your options. All right, so why does this matter? One of the reasons why it matters so much is that we spend as adults the majority of our life trying to not get pregnant, right? And so when the time comes when we're ready to procreate and we're ready to start a family, we often don't know where to begin. And really want to focus this next few minutes on making that right. And this isn't something that is unique to certain socioeconomic classes or unique to your level of education. I often argue that I know a lot of physicians who have gone to medical school, residency, who don't know very much about reproductive health. So this is something that really transcends all categories. And it's just so fundamentally important to understand it, because then with that understanding comes empowers you with the opportunity to make decisions that are right for you. All right, so let's bust some myths, right? So fact or fiction. So just want to kind of rapid fire go through some of these with you. So one of the questions, these are questions that we get from our patients. I'm sure Dr. Garvin will agree, but these are also things that exist on the internet that sometimes Dr. Google kind of can be misleading. I'll just read them to you and then give you the fact or fiction. So I should lay flat for 15 minutes after having sex. That is fiction. So we do not need to lie flat after having intercourse. As a matter of fact, many babies have been achieved with standing up or at various positions. So remember that only one sperm has to reach the egg. And from the moment that ejaculation occurs, millions, over 20 million in a normal ejaculate of sperm are released. And so where you lie or how you lie is not going to impact your ability to conceive. The next one is conception is easy after baby number one, is also totally fiction. So just because you had a baby doesn't necessarily mean you'll easily be able to have a second baby or a third baby. A lot of that is going to depend on how old were you when you had your first baby, and then have you experienced any surgeries or trauma in between from the time you had your first to the second. There is, people will come to me and be like, oh, well, it was really easy for me to have my baby when I was 30, so it's going to be easy for me to have a baby now that I'm 39. And the truth is that 9 years have passed and your fertility is going to change. So just because you're able to easily have a first baby doesn't necessarily mean it'll be easy to have a second. Next one is giving up coffee is going to help you get pregnant. And I'll add to this is just changing your diet is somehow going to help you get pregnant. And the reality is that while it is good to do everything in moderation, and I don't advocate for tons of coffee or caffeine drinking, changing your coffee intake or your caffeine intake, or even for that matter, majority of your diet intake isn't going to help you get pregnant and isn't necessarily going to make you more fertile. So that's really important to know, because there's a lot of gimmicks out there and a lot of people who think that if they do a cleanse, they'll suddenly be able to conceive. Advocate for healthy living, but this is fiction. Another one is that adoption is only way for LGBTQ community to grow a family, and that's absolutely fiction. There are so many paths to parenthood, whether you are a same-sex female couple, a same-sex male couple, or you are a transgender person, or you want to have a child on your own as a single woman. And there's multiple paths to parenthood, including surrogacy, including donor eggs, donor sperms, even donor embryo. And we're here to help you every step of the way. This is often a process that can be really scary, but we're here to help you every step of the way and make it as simple as possible. The next one is being on birth control for 5 or more years will hurt my chances of conceiving naturally, and that is absolutely not true either. Birth control prevents pregnancy while you're taking it, hence that's why it's called birth control, but it's not going to harm your ability to get pregnant in the future. And that's true for all forms of contraception. Now, one key thing to keep in mind, though, is long-term birth control use means that a long time has passed. So if you've been on birth control for 20 years, it's not the 20 years of birth control that made you less fertile. It's the fact that 20 years have passed. And so if you were on from 20 to the age of 40, you're now a 40-year-old trying to get pregnant. And it's the fact that you're 40 that's harming your fertility, not the 20 years of being on birth control. And then last, this is a funny one, but adding oysters to your diet is going to increase your egg count or make you more fertile. I wish this was the case, but also fiction. Next slide. All right, so what should we know? The key is, and hopefully going through some of those fun facts and fictions helped you understand, is that when it comes to fertility, the most important thing we need to know is that a woman's age is so imperatively important. So let's start at the beginning. Why does age matter? Well, the reason for it is that as women, we're born with all the eggs that we'll ever have. And there is no science, no technology that will allow us to make more eggs. So at birth, as women, we have about 2 million eggs. By the time we reach our very first period, so think in your mind, you were probably somewhere between 9 and 15 typically, we're already down to 300 to 400,000 eggs. And then from there, every single month, we lose up to 1,000 eggs. And that loss of up to 1,000 eggs a month happens even if you're on birth control, even if you don't get a period, has no direct correlation to menstruation or bleeding. And this is just a loss that occurs. And I think it's unfair. I'm sure you think it's unfair, but it's the reality of what happens. And it's really important for us to be aware of this, because if we're not, then that's where our fertility can really impact us. So age matters. We're born with a maximum amount of eggs and we lose them with time. So what is all this about age, right? So there's a lot of people know about the number 35, and sometimes I have people that come and think it's different. It's 30, it's 40. The truth is that since we're born with all the eggs we'll ever have, we're starting to lose eggs from birth, right? It's not this scenario where you're perfect, and at 35 you somehow fall off a cliff. The reality is we're losing eggs from birth. So if we understand that, then we realize that by the time the majority of women, not all, but the time the majority of women reach the age of 35, by the virtue of they've lost eggs from birth, many women 35 and older will have lower egg counts. So again, it's not that you're perfect, fall off a cliff at a certain age. It's just a virtue of that time and the gradual loss of eggs. The other thing to understand is that 1 out of 10 women can experience a premature drop in their egg counts or experience low ovarian reserve under the age of 35. So that's really important to understand, that there are women who are going to have low fertility under the age of 35. And then there's going to be some women who are 40 who are still fertile. And so the key with this is that not to assume that you're fertile because you're young, but also not to assume that you have no options and that, you know, your ship has sailed because you're older. All right, so far we've been talking about egg count, but so imperative to also talk about egg quality. And by quality, I'm referring to the DNA, to the genetics of those 23 chromosomes that make up an egg cell, right? And so because we're born with all the eggs we'll ever have, our eggs age with us, right? So what is aging? Aging is a process of our cells deteriorating. So why do we get wrinkles? Why does our hair color turn white? Why does our body change? Why does our skin change? Our texture, the way you look change as you get older? It's because our cells are aging. And one of the cells in our body is our egg cell. And so that's really important. And you know, unfortunately, while we're really good at telling you about your egg count, there is no scientific way to check the quality of a woman's eggs. We just know that there's a direct association with age. So the younger you are, the healthier your eggs genetically will be. All right. So what is the reality? It's that you are never too young or too old to learn more about your fertility. I can't say this enough. And it's so imperative to be proactive. Again, don't assume you're good because you're young. Don't assume you don't have options because you're older. The key is to come and see us. And Dr. Garvin's going to really go into what is an assessment and what are we learning, but to come and see us and learn about your specific body, learn about your partner's body, learn your true facts. Don't take my word for it. Let's find out what is your reality, what is your truth. And then from there, you can say, okay, here's my plans. I'd like to have 3 kids. I want to have 4 kids. I don't want any kids. I want them today. I want them yesterday. I want them 10 years from now. And then we can be proactive together. All right. So when are we most fertile, right? If we're going to talk about all this fertility stuff, let's get to basics, right? So the reality of it is that we're only fertile for about 5 days a month, right? Again, we spend our entire life thinking the moment we have unprotected sex, we're going to get pregnant. But the reality is we're not as fertile as we think. So in this example of March 2021, this person would have started their period on Monday, the 1st, where that red circle is. Her most fertile days would then be the 10th through the 14th. So in a woman who has a regular menstrual cycle, and that's key, a regular, menstrual cycle where maybe you're getting your period every 28 to 32 days or so, your most fertile days would be days 10 through 14 of your cycle, where the first day would be the first day of bleeding. And this is really important to know whether you're trying to avoid pregnancy or whether you're trying to get pregnant, because if you know what days to avoid or what days to be intentional, it can help you conceive or help prevent pregnancy. All right, so what factors impact fertility, right? Diet and lifestyle are certainly important, but again, back to our myth busters earlier, it's not that you can have a certain diet. I wish there was like a supplement I could give you to make you more fertile, but diet and lifestyle do matter. And one of the things that we really have to stress is that cigarette smoking has been proven to harm fertility for both men and women. So if you need another reason to not smoke, your fertility would be an additional reason. And so that's really important. And obviously just advocating for being healthy, knowing that being underweight is just as unhealthy as being overweight, and that everything in moderation, including alcohol. Family history is really important, but maybe not so much in the way that you think. Family history is really important in that if you have women in your family, your mom, your aunts, your grandmother, women in your family who went through premature menopause, meaning that they naturally stopped getting their periods under the age of 45, could be an indication that you are at risk for early menopause as well, which would then mean that your rate of decline may be more rapid than another individual. So many of us may not know how old our parents or grandparents or aunts were when they stopped getting their periods. So I really encourage you, if you have access to your family, to ask them, how old were you when you stopped getting your periods? And remember, it's natural menopause, not surgical. And the last thing is our mental health is so vitally important. And we have therapists available as well as nutritionists available through Kindbody. You can make appointments with them literally right now at kindbody.com. And it's really a balance, right? We can't forget about our mental, emotional, and nutrition health because it becomes such an important part of our general health as well as our fertility. All right, so what does it mean to be infertile, right? What is there's actual definitions. So if you are under the age of 35, the definition of infertility would be that you have tried to conceive and have not been successful over a 12-month period. If you're over the age of 35, if you've been trying to conceive over a 6-month period and have not been successful, by definition, that would be infertile. So with these definitions, 1 out of 8 couples can experience infertility. It's much more common than we think. Unfortunately, we do a disservice to each other because we don't talk about it, right? These are things that are often behind closed doors. So I just want you guys to know that it is quite common. So if you're one of the people that meets these definitions, you are not alone, and we are here to help. The other thing that's often forgotten is that we all think fertility is a woman problem, but 1/3 of couples who are experiencing infertility, it's actually because of the man and male factor issues. So I implore you not to forget, if you happen to have a male partner, that it is just as important for him to have a semen analysis as it is for you to have your fertility assessed. And then the final part that's so important is that we at Kindbody, and I'm sure Dr. Garvin as a fertility specialist agrees, we don't want you to wait an entire year before you find out that your partner had a semen problem or that your tubes are blocked or that you have a low egg count, which is why we really advocate for being proactive. So that if you are planning on starting to try, or maybe you've already been trying, there is absolutely no harm in coming in, making sure everything is okay. So then you have the peace of mind of, okay, things are fine. Now we're going to keep trying. Or in the event that we do find out something is wrong, the sooner we find out, typically the more options we're going to have and the more successful you can hopefully be. All right. So at the end of the day, the key is that there's no magic formula and that everyone is unique and different. And that the only way to really know what are the options and what are your choices and what is the best treatment for you is to come and get evaluated. And I'm going to hand that off now to Dr. Sicily Garvin, who is one of our reproductive endocrinologists and infertility specialists. She is going to be the head and lead physician of our Atlanta office, where I am actually sitting with you right now. And I'm going to hand it off to her. Dr. Garvin, without further ado, take it from here.
Thank you so much, Dr. Sasan. That was a great introduction, and I really appreciate the fact that you went through in such detail what it looks like for fertility and for women and for the couple. And so I think the next slide is going to be talking about what the assessment looks like. Dr. Sasan made a very good explanation as to why we need to have assessments, but what does it look like? So, I think the first step is, looks like where I'm sitting right now, which is at Kindbody's fertility assessment room. I'm in a consult room currently, and so you can see it looks very comfortable here. You come in, we have a one-on-one discussion with a fertility specialist. That could be either your reproductive endocrinologist, one of the GYNs here, our NPs, or our PAs. They'll sit down, they'll talk to you. It can be virtual or it can be in clinic. And when they talk to you, we'll go over all the things that Sasan just mentioned. We'll talk about your history, your personal history, your family history, as well as things that are maybe we needed a fix in your diet or lifestyle factors. And we'll see how all that plays into your fertility in the future. After we talk to get an idea more about you, then we'll do what's called an ultrasound that goes in the vagina. That ultrasound allows us to then take a look at the ovaries, where eggs are made, as well as look at your uterus to see what the uterus looks like. The ultrasound of the ovaries allows us to see the eggs that are growing inside the sacs called follicles. And that same day from the ultrasound, you'll get what's called an antral follicle count, which is a count of the resting follicles that are in your ovaries. We also will then encourage you to have blood work done. And that blood work allows us to then to correlate with the ultrasound to see exactly what your hormone levels look like. And one of the most helpful hormones is the anti-Mullerian hormone, also called the AMH. We're able to draw that in the office for you that same day. And then we'll give you a message in your portal shortly after that to tell you what your anti-Mullerian or AMH level was. And together, both the AMH, which is and the follicle count, or the antral follicle count, allow us to give you an idea of what your ovarian reserve or remaining egg supply looks like. This is important because even though we have those average numbers of what we expect in fertility as it declines, as Dr. Sasan mentioned, everyone is very different. And this is the first step at which we get to identify how are your egg numbers for your individual situation. Once we have the information from that assessment, we have many options. And that's the take-home point from I hope you get from this talk, is that this is supposed to be opening up a world of options for you. And depending upon what your goals are and where you are in reproductive potential, their options would be including egg freezing, which is then an option to freeze your eggs for potential use as fertility preservation. Also, options are embryo freezing, which means to take the eggs that you have and combine them with a sperm source, whether that be from your partner or from a donor sperm source, to make embryos. And those can be frozen for future use, another option for preserving fertility. And then finally, we have treatment options. If you are having infertility for some reason, we have ways to help overcome those fertility barriers, including things like either an IUI, which is an intrauterine insemination, where we're able to put sperm into the uterus at the right time, or IVF, which is in vitro fertilization, where we're able to, again, extract eggs, combine them with sperm to make embryos, and rather than freeze them, we can actually put them back into the uterus at the right time for pregnancy. I briefly mentioned egg freezing, and egg freezing is actually revolutionary. I will tell you, as Dr. Sasan mentioned, we're going with all the eggs we're ever going to have. And furthermore, if we don't use them, we're going to lose them. But the best thing about what we're able to offer as fertility specialists is that we're able to offer the option of egg freezing, which allows you to preserve your fertility at this moment in time. With that being said, let's talk about who should consider egg freezing. I would say you can start by thinking reproductively, what are your goals? And some of those goals can be defined by asking these simple questions to yourself. The first one would be, how old are you? It's important to know how old we are. Second would be then to ask yourself, ideally, how many children do I want to have in the future? And then the next question would be to ask yourself, what do you think is the earliest you'd be ready to have your child? And the final question would be this: what is the latest you want to be having your last child? Those four answers together will allow us to help to determine when's the best time and should you consider freezing eggs. With that being said, maybe you're not ready for egg freezing for your first child, but if you want to have children in the future, maybe that's 2 or 3 or even 5 years from now, considering egg freezing now would give you the options after the first child to have, again, eggs preserved at this current age and quality. So how does egg freezing work? I think this is a great time to go back to ovulation and the menstrual cycle. And it's kind of one of my favorite things to talk about as fertility specialists, because it really is controlled by the brain. And I think the brain is sending hormones, and hormones, as we mentioned, one of the ones we talked about was the anti-Mullerian hormone. That one's made by those follicles, but we actually know that the brain makes their hormones also that controls how those follicles, which contain the eggs, are growing. Every month, your brain tells your ovaries to make a group of follicles grow. And from that group, one follicle will become the largest follicle, we call the lead follicle. That one is usually ovulated every single month, and all the others in that group go away. The benefit and the point of egg freezing is for us to allow you to have all those extra eggs, rather than losing them that month, actually get them, retrieve them, and freeze them for use that month. So I talked about those hormones that your brain makes, and it's important to know those hormones. One of them is called FSH, or follicle stimulating hormone, and the other one is called LH, or luteinizing hormone. And it's important to know those because those are the same hormones that we give you in the medications that you're going to be using during a stimulation cycle, either for egg freezing or for IVF. And by giving those hormones in higher doses, we're able to allow, rather than having the one lead follicle develop, we're able to encourage as many of those follicles that are resting to grow as possible that month. And so how do the hormones work? You'll see in this picture, actually, I like this picture a lot. You have our PA, Hina, who's showing you how the hormones work. And so they come from the pharmacy directly to your home. And these hormone injections are actually very easy to use. And Kindbody has on our portal very nice tutorials that are actually demonstrated by our PA, Hina, who will show you exactly how to give yourself the medications. And so you will be administering the medications to yourself at home. You also can be someone, you can have a friend or anyone else, loved one, help you administer the injections if you need to at home. Okay. The injections are administered for about a total, an average of 10 to 12 days. During that time period, we're going to ask you to come in so that we can monitor and see how your ovaries are responding to those hormones. You'll come in for monitoring visits, which includes an ultrasound, again, in the vagina to see the ovaries and the growing follicles, as well as a blood test to monitor the hormones that are being made by those growing follicles to make sure that you're responding to the medications as we would expect. Here's a little sample of the timeline, which is very nice to look at. And so it all starts with your period usually. As we're talking about the cycle in your brain, the period, which is the very first day of bleeding, is the first day of the cycle when we start this process. There's many ways for us to have you stimulate or take the medications. One example of that is shown here, and that's where you would call with the first day of your period that you want to start your stimulation cycle. And then you'll come in for ultrasound and blood tests on day 3 of the cycle to make sure that your ovaries are quiet and your hormone levels are low. If everything looks good at that visit, you'll get a message in the portal from us saying it's okay to start medications for your stimulation cycle. You'll take the medications, as I mentioned, on an average from 10 to 12 days, during which you come in for additional visits to monitor and see how you're responding. Typically, around the 10th to 12th day, you have a good number of follicles that are the right size to have a mature egg, which is going to be the egg that will be able to combine with sperm in the future, that we're able to retrieve from your ovaries. That's the point at which we tell you it's time for your trigger. And the trigger shot is administered at that time. That prepares you for the retrieval, which is done 35 hours after you take your trigger shots. Well, this is the big day we've all been waiting for. So we've taken our stimulation shots. You've come in for all your ultrasounds and your monitoring. We get the right number of follicles that are the right size, and we give you the trigger shots to get you prepared for the retrieval. Now we're 35 hours after that, and you come into the office again. This time you're coming in for your procedure. This is the procedure that we go in to remove those eggs from those growing follicles. That way they can be frozen for you. During the procedure, you will have about 10 to 15 minutes during which we're able to retrieve those eggs. You will be asleep in the procedure with a very light sedation, breathing on your own, but completely comfortable during the procedure. Once those eggs are retrieved, they can then have 2 options. The first would be to freeze them as eggs, and that would be freezing them for future use with a sperm source of your choice. The second one is actually to make embryos at that time, so to combine them with a sperm source of your choice at that time, whether that be donor or partner sperm, and to freeze embryos. Both of these are viable options. And again, it goes back to your goals. Are you looking to freeze eggs for future use with a partner or a donor source in the future? Or have you already met your partner or sperm source, or you've identified your donor sperm source and looking forward to freezing embryos at this time? The nice thing about freezing embryos is that it allows us to get a little bit more information about the quality of the eggs. Dr. Sasan mentioned briefly that quality is related to your age, but it is very helpful to know that even with age being not considered, there can be quality changes in our eggs over time. By combining them with sperm, we get more information about the quality, because a better quality egg is more likely to combine with the sperm than a poor quality egg. So once we have the eggs frozen, and if you choose, once we have the eggs retrieved and you choose to freeze eggs, we will freeze them for you here at the Kindbody offices. They're frozen in liquid nitrogen, and they're actually stored here as long as you want them to be. I often get the question, how long can they be stored for? Well, we know that people have been using frozen eggs for at least 20 years. And so I would hope that during the time at which you're planning on having children over the next 20 years, these eggs would be frozen for you and could be used at any point in time. Ideally, my hope is that you'll get pregnant with plan A, which would be not to need to use these eggs. But again, these are just options that we have for you if you for some reason have trouble or desire to use these eggs in the future. You could use them through a process of IVF, where we're able to combine them with sperm to make embryos. A little bit more about IVF and how it works. So IVF is a process, as I mentioned kind of briefly, where we have the eggs once they've been retrieved, whether that be from a fresh cycle or using eggs that are frozen from a previous cycle that you used for egg freezing. They can then be combined with sperm. And in a fresh cycle, they're combined during that same cycle. And if they're using frozen eggs, we thaw the eggs and combine them with sperm. That makes our embryo. Embryos can then either be frozen and transferred at a later time, or when the uterus is prepared for a frozen embryo transfer, or we can actually transfer the embryos at a fresh cycle. That means after the eggs were originally retrieved, we can transfer the embryos in that very same cycle. We mentioned briefly ways to preserve our fertility. That includes egg freezing and embryo freezing. We also mentioned briefly IVF, which is a means by which we're able to help treat infertility and become pregnant by transferring an embryo, whether it's a frozen embryo or a fresh embryo. But I want to go back to what Dr. Sasan mentioned about paths to parenthood. There's many paths to parenthood, and parenthood looks differently for everybody. Whether that is someone who is a single person choosing to do this single by choice, whether it's someone who is in a relationship with a heterosexual person, they're having trouble in the relationship getting pregnant, whether it's someone who's in a same-sex relationship and doesn't have either egg or sperm in their relationship, or whether it's somebody who is choosing options of path to parenthood because they have genetic conditions, they want to be able to test for those genetic conditions with other options for parenthood. So I think the most common path is going to be natural conception. That's the one that we always hope that you're able to obtain. But if for some reason you have trouble getting pregnant, as for the reason we mentioned earlier, there are other options. The first would be insemination, which is called an IUI, or intrauterine insemination. And that can be done with any sperm source, whether they be donor sperm or partner sperm. We place that sperm in the uterus at the exact time that we expect the egg to be there to meet it, to make a pregnancy. And the other option we mentioned again was IVF. And I want to just go back to IVF and let you know that can be done with either your own eggs, but if for some reason you have problems either with egg numbers or egg quality, or you don't have eggs in your relationship, we can also use donor eggs if we need to. And as a caveat, we can use donor sperm for the same reasons. If for some reason there's a problem with the sperm numbers or the sperm quality, or if there's no sperm in your relationship, there's options for donor sperm as well to be used for IVF. And then finally, some couples have trouble with getting pregnant because the female partner is not ovulating and releasing her egg every month. If that were the case, we actually can give you medications to help you induce or cause ovulation in situations where you're not able to ovulate that month. And at Kindbody, it's important for us to give you all of your options for family building. We mentioned briefly egg donors. These are people who have been very kind and who want to help everybody build their families. They're typically younger than the age of 30, and they have good quality and good egg numbers. They undergo what I mentioned earlier, stimulation of their ovaries with the medications, and they have a retrieval, and those eggs are frozen to be given to families that need to use them. There's also options for sperm donors, and those sperm donors, again, are people who are young and healthy, who have chosen to allow sperm to be frozen to be used in relationships where they need that sperm to be frozen and thawed. And then finally, for some reason, you also have options for gestational carriers. This is someone who will carry the pregnancy if for some reason there's not someone that can carry the pregnancy in a relationship, or if you choose to have a gestational carrier for medical reasons, or that precludes you from carrying the child yourself. And the one that we haven't mentioned here is adoption. I think it's important to keep this as a path to parenthood, because if parenthood is your goal, there are many ways to get there. And so let's talk about next steps. We've kind of, I hope through Dr. Sasan and my talk, have given you a good idea of what fertility assessment looks like and why it's important to have that done. And I'd say the next steps is whether you're actively trying to get pregnant today, tomorrow, or even just have an idea, maybe someday you want to do that. I think it goes back to this really important concept where it's important to get education about where you stand and where things are. And that starts with a simple assessment, as we mentioned from the very beginning.
All right. Thank you, Dr. Garvin. That was so informative. I feel like even I continue to learn things and do this for a living. So thank you so much. So kind of going back to Kindbody, I wanted to let you guys know, and I know at the beginning of the chat, we started off with where is everyone? And many of you are very close to a Kindbody center. So just to kind of recap, we have 2 locations in Manhattan, 1 in Princeton, New Jersey. We are located in downtown San Francisco, as well as in Los Altos and Palo Alto near Stanford University. We're also located in Santa Monica, as well as in Century City in Los Angeles. We are here in Atlanta, which just opened this week. And I'll show you guys the space in just a moment at the end. And this is Dr. Garvin's home. So if you enjoyed listening to her as I did, you could actually make an appointment to come and see her as early as next week. We're opening in Austin, Texas at the beginning of June, and then in Orlando, Florida later in the summer. And then before the end of the year, we'll also be opening in Minneapolis as well as in Denver, Colorado. So these are the centers that we currently exist in. We also have centers of excellence that we work with. So if you happen to be in a place that I didn't mention, you can still do a consultation with myself or Dr. Garvin or any one of our amazing providers virtually, and then we can help you and direct you to your next steps. So again, if you don't happen to be near one of the places that we are located, we can still be a provider for you through our virtual offerings. So we look forward to seeing you. And as a bonus too, the reason why Atlanta is starred is that we're celebrating Atlanta's grand opening on the 14th, on April 14th, so next week. And we invite you to come if you are in the Atlanta area. There will be treats and beverages, as well as lots of fun prizes and a raffle, but it also gives you an opportunity to meet our physicians and our providers. It is going to be COVID safe, so we will have social distancing and really take those precautions, but come and meet our providers, see the center, maybe ask some of your questions that you want to ask one-on-one before you get started. So again, that's going to be on the 14th, and we'll be sending you more information about that through our channels after this and through an email, but we do welcome you and hope that you can join us for that. All right, so let's talk a little bit about cost. It's like the elephant in the room whenever you're talking about fertility. We really pride ourselves in being transparent. So you can go to kindbody.com right on our website and look at the prices for our services. They're all there for you. So a fertility assessment is typically $300. And so for those of you who put in the code for today's talk, which is awareness, again, that code is awareness, you can get 50% off, and so that appointment becomes $150, or just the price of your insurance copay, because we do accept all major insurances, and a fertility assessment can certainly be covered by your insurance. An egg freezing cycle, it has a $500 discount with the awareness code, so it's $6,000, and that does include anesthesia and the first year of storage. IVF cycle is $12,500 with the awareness discount code, and an IUI cycle is $1,000. All of these prices do not include the cost of medications. Our team will tell you the exact cost of the medications that will be individualized based on your fertility assessments. And we do have lots of discount programs that we can tell you about for the medications. And we also do use a third party called Future Family that you can utilize so that you can do payment plans instead of paying it all for once. If you do have benefits, we have a dedicated benefits team that can help you understand what does my insurance cover? What does my insurance not cover? What does my employer cover? What is my deductible? How much have I paid? All of those things that kind of make me go crazy. Our dedicated benefits team can help you answer those questions. And so just know that we're here for you every step of the way. All right, and we do accept all the major insurances. You can also use FSA and HSA to pay for your appointment itself, or the copay, or for any of the actual treatment cycles. So we do want you to know that we do accept all of these. So you can go directly to kindbody.com. You could do it right now or later at the convenience of your phone or your laptop. Go to kindbody.com and you can schedule appointments directly online. You don't have to call anyone or be on annoying hold. And then when you go through the process, just put in the code awareness for all of the special prices. And the prices, you don't have to commit to freezing your eggs or doing anything today. Just so long as you put in that code, we'll honor the discounts when you're ready to actually do your cycle. We're going to go to questions in just a moment, but if you do have anything, you could always email us at navigator@kindbody.com. We also work with employers. So we are a benefit for many employers. If you don't see your company listed here, let us know and we'd be happy to approach them. We do have a designated team that can actually go to your employer, and we've had patients do this. They've come and said, we have a lot of people that work in our company that are interested in these types of fertility benefits and discounts, and we've helped actually champion their cause for them, and they now have those benefits. And so we can help you explore that. You may have work somewhere and you have benefits you didn't even know about. We can help you better understand that as well. So that is another perk of being with us and being a part of our family. All right, so I'm going to hand it off to Amanda Lynn, who is one of our Kindbody team members. And Dr. Garvin and I are both here to answer your questions. We hope you found this informative. And again, we really encourage all of you to take the first step, which is just learning more about your body.
Yes. Hi, guys. Thank you so much. The chat was on fire. Thank you so much to the Kindbody team who was helping field a lot of those questions. I'm going to share a few here back that weren't like completely explicitly answered or that our team just didn't have time to get to. So Dr. Garvin, first, how effective is egg freezing and how many eggs are still viable after being thawed on average?
It's a great question. So egg freezing in terms of effectiveness is very effective, but it also depends on, many factors. The first is what is your anti-Mullerian hormone? So that's that hormone that we talked about. Second is what is your antral follicle count or your AFC? And the third is how well do you respond to the medications? Everyone responds differently. And so we have to see how you respond. Then the third thing is in terms of effectiveness is how many eggs do you need in order to have a baby in the future? This is a plan B option for most people. And so the question becomes, what chance do you feel comfortable with? And so it really depends on your age and those other factors that we went into. And I'm happy to go into those in a consult to talk to you about exactly what number of eggs you should be hoping for, what goal egg number you should be having in order to have the chance that you want to have for having a baby in the future. And in terms of how well eggs are surviving the thaw, they're doing better and better than we had been doing previously. We have amazing labs here at Kindbody, and so we have really good freeze and thaw protocols, and we're actually able to hopefully get about 80% of our eggs to be surviving the thaw.
Wonderful, thank you. Dr. Sasan, how drastic is the change in quality of eggs from year to year? Is it a sharp drop? Is it more gradual? Is there something we should be looking out for? Even like getting our AMH tested regularly or follicle count tested on an annual basis?
Sure. So two parts to that question. The follicle count and the AMH and getting your fertility tested, remember, is telling us about your egg count. The AMH level and the ovarian reserve and the ultrasounds tell us nothing about your egg quality. So it's really imperative. There is no test that we can do to tell you about the genetic quality of your eggs. We can tell you if you're a carrier for genetic disease. We can tell you the risk for genetic diseases like cancer, but we can't tell you the quality of your eggs. So then I said it's related to age. I think the key thing to understand is that at any age, we still do have some good eggs. So like a good way to think about this is a 20-year-old, about 90% of her eggs are going to be genetically normal, and maybe 10% would be genetically abnormal. Now switch that to a 40-year-old. A 40-year-old, 90% of her eggs are going to be genetically abnormal, and maybe about 10% will be genetically normal. Do you see? So at any age, people do have some genetically normal and genetically abnormal eggs. It's just that as you get older, the percentage of genetically abnormal will increase. Unfortunately, because there's no way for us to definitively check the egg quality, we also can't tell you, oh, here's the exact rate of decline from year to year. So it's just important to keep in mind, when do I want to have kids? How many kids do I want to have? And understand that the quality and the quantity will decline as you get older.
Great, thank you. A quick follow-up to that one. Is there any way to test the quality of eggs before freezing them?
There is no way to check the quality of eggs, and there's no way to check the quality of sperm. However, once we take an egg and a sperm and create an embryo, then we can biopsy the embryo and tell the genetic health of the embryo. So that's one situation where if someone is older or someone does definitively want to know the quality of their eggs, it would require to actually make that egg into an embryo. At that point, we can do the genetic testing and tell you how healthy that embryo is.
Wonderful. Dr. Garvin, does egg freezing reduce our chances of getting pregnant naturally?
Oh, I love that question. The answer is no. So as I mentioned kind of briefly, and I'll say it again, is that these are the eggs that we are gathering and capturing that are, if we don't use them, we're going to lose them. So these are the eggs that were going to be lost that month anyways. They're the group that was being made by your ovaries, that one of them is going to be released and the other ones are going to be lost. So we're just going to hopefully rescue those from being lost and save those for future use. No effect on your fertility or on your age at which you go through menopause in the future.
Wonderful. Thank you. And this one can kind of be for both of you, whoever feels most comfortable answering, but like, what LGBTQ services do we offer? Do we have affiliations with any egg banks or sperm banks that could help with people who are looking for egg and sperm donors?
Dr. Garvin, would you like to take this one?
Oh, we can do it. We can do it together, but I'll start if you like. So we are very LGBTQ friendly, and I think there's lots of options. And so as I briefly went through, we discussed egg donors and sperm donors as well as gestational carriers. And I think the first part of that is that we actually offer reciprocal IVF appointments here. So that's an appointment that's a little bit longer. So it's an hour-and-a-half appointment, where if you are a same-sex couple, same-sex female couple, we're able to go in through and talk to you about all the options of same-sex female couple partner family building. And that includes, whether that includes inseminations for one partner, inseminations for the other partner, IVF for one partner, even reciprocal IVF. We go through all of those options. And then when it comes for same-sex male couples, again, we can do a visit where we can talk to both people in the couple about how we can help with family building. And I think it takes three things. It takes the egg, the uterus, and the sperm. And so when it comes to any couple, we really want to just figure out, where do we want to get the eggs from, where do we want to get the sperm from, and how do we want to carry that pregnancy? And so once we have those things established, then we have options. If we need to use an egg donor, that can either be done with a donor egg bank, and we do have several that we can recommend to you. There's also fresh donors, which means someone that can be picked from an agency that can undergo stimulation medications, like I mentioned, and their eggs specifically for you can be retrieved and frozen for you in your family building. In terms of sperm building, sperm partner, sperm source, we also have the options of using, again, frozen sperm, and that can come from a sperm bank. And the frozen sperm from those banks, there are a few that we work with. We don't have any work directly, but we can recommend some to you for sperm banks. And if you need to use a gestational carrier in your family building, we have options for referring you to agencies that have gestational carriers that can establish a relationship for you. Sasan, do you want to add anything to that?
No, that was excellent and really thorough. The only thing I would add is that any of the recommendations we have, whether it is a sperm bank or an egg bank or the gestational carriers or even reproductive attorneys to help you in this process, all of the resources that we use are heavily vetted. We want to only recommend places and agencies that we would use ourselves or that we would want to recommend to our own family. So just know that it's not like we just give you a list and tell you like, good luck. We're really heavily vetted, and we'll help you with the legwork, contacting the agency. How many vials of sperm should you get? Is this the right is this a good match for you, by allowing us to kind of look at your genetics results and other factors that play a role. So we really partner with you, and it's all really heavily vetted.
Thank you. I did see a few questions in the chat about financing. The best way to have those answers or those questions answered is to reach out to our navigator at kindbody.com. They are the best equipped to look at your situation and also to look at your insurance options. So please reach out there and we can help you with all of your personal individual questions. And then the other question, which I was so excited to see because I'm so excited to get to Atlanta next week and open our first clinic in the Southeast, is when is the grand opening for Atlanta? So it's next Wednesday, April 14th. It's 5:30 to 7 p.m. We will be sending out a follow-up email thanking everyone for attending, sharing the discount codes again, and we will include a blurb in that about how to RSVP and how to join us and how to make an appointment in Atlanta with Sicily. You're going to be very busy next week. So thank you everyone so much for joining us. This was wonderful. Thank you, Dr. Garvin and Dr. Sasan. And we hope to see everyone in a Kindbody clinic soon.
Thank you.
Bye guys. Thank you so much.
Bye-bye. As you're leaving, I'll show you this beautiful Atlanta.
Oh yes, please, please.
Oh, thank you for the tour.
Yeah, so this is our beautiful Atlanta office, just ready for you guys to come and see us. Really welcoming, as you can see. And we're right here waiting for you. So please come and see us. Dr. Garvin will be here. And you don't even have to wait for the grand opening. You could literally make an appointment and come see us tomorrow or Friday, or as early as next week. So we're so glad you could join us. Thank you again. We hope this was informative. And please visit our website to make appointments and come and see us soon. Take care. Good night, everyone. Have a good afternoon.
Good night. Thank you.
Thanks for joining us. And please, if we didn't answer your questions, reach out to us at navigator@kindbody.com. We'll be happy to answer any questions that you have.